Flu cases, hospitalizations, and deaths have nearly doubled from just a week ago. That health alert from the CDC today. It is the highest spike in nearly a decade. The CDC is reporting 23,000 hospitalizations and 1,300 deaths. This wave of the flu is putting a strain on children's hospitals across the country. Many are already feeling the crush of respiratory illnesses like RSV. And the pressure is being felt right here in Hampton Roads. New data from the Virginia Department of Health shows flu-like illness activity is very high right now.
That has snowballed since early October when health experts reported minimal activity. A doctor at Children's Hospital of the King's Daughters says RSV and flu cases are keeping their staff extremely busy. Allison Basil spoke with a mother whose son spent several days at CHKD.
It was the worst thing I have ever experienced in my life.
Katie Halterman says her 2-year-old son Brandon came down with RSV in mid-October. She says his symptoms worsened after his first doctor's visit.
He was just working really hard to breathe.
Halterman's family lives 4 hours from Norfolk. She says doctors sent her son to a Richmond hospital where he had to go on a ventilator. From there, they life-flighted him to Children's Hospital of the King's Daughters.
Just seeing my baby with a tube in his mouth was the worst thing ever.
CHKD Chief Medical Officer Dr. Chris Foley says hospitals across the region are swamped with respiratory illness cases. Recently, he says CHKD staff started turning away patients from outside Hampton Roads.
We get calls from Richmond, Salisbury, Maryland to North Carolina. Virtually every 12 hours or so, there's people looking for those beds.
He says flu cases are keeping staff extra busy.
Basically a tripling of the amount of flu that we were seeing before.
When it comes to respiratory infections, Dr. Foley says children under 4 months of age and people with underlying illnesses are most at risk. But he says the infections are hitting toddlers like Brandon hard due to the COVID-19 pandemic.
Even though they should be able to handle it as a cold, there's no immunity.
Dr. Foley says you should take your child to the doctor if they are having difficulty breathing, turning blue or gray, not sleeping, or refusing to eat or drink.
I always tell parents that your parents' instincts are right.
Halterman says Brandon came home last week. He's starting to run around again, but she says he still has some recovery ahead.
Anytime my children get sick, I'm taking them right to the doctor. I never, ever want to go through this again.
In Norfolk, Allison Basil, 13 News Now.
Virginia Department of Health data shows 1 in 5 patients going to the emergency room or urgent care for the flu are children 4 and younger.